This course provides information on all the inhalers and devices that are available and recommended for the use for patients with COPD. Hello, my name is Rona Hastings. I'm one of the respiratory nurse specialists at Cross House Hospital. The session today I'm going to be looking at an inhaler technique, and we're going to look at some of the more commonly used inhalers. The ones we have here are the dry powder inhalers that we generally use, and the ones on the other side are your aerosol inhalers. The first inhaler we're going to look at today is the Turbohaler, which is a dry powder inhaler. To activate this, you would take off the cover. The patient would hold the inhaler straight up and down. They would twist the bottom in one direction till it can go no further, and twist back the other till they hear the click, and again it goes no further. The patients would take a breath in, breathe out fully, and then insert the inhaler into their mouth, taking a deep breath in. Once they've taken their breath in, they would remove the inhaler, close their mouth and count up to about 10 seconds if this is possible. For some chronic lung conditions this is not feasible, so they should hold their breath for as long as they feel comfortable. To take a second puff, they would start the process again. I will now demonstrate how you would use a Turbohaler. As I said, you would remove the cap, hold the inhaler, twist, twist, Once the doses are completed, the cap is replaced to keep the inhaler clean. It's important to remind patients who are using the Turbohaler there is a dose counter. It's dependent on the drug what the dose will start at. It'll either be 120 doses or 60 doses. Another dry powder device that is frequently used is the Accuhaler. To activate this, patients will apply their thumb, push the device down until it clicks. There is also a lever here that they push down until it clicks. The device is now ready to take the dose. Again, the patients will breathe in, breathe out, have a good seal round the mouthpiece and inhale deeply. They will then remove this from their mouth, closing their mouth and counting again up to 10 seconds if this is possible. To take a second dose, they would close the device and start the process again. I will now demonstrate how to use an Accuhaler. The device is now ready to be activated again. It's important to remind patients that there is a dose counter on the Accuhaler. This starts at 60 and works down to 0. It's also important to remind the patients that the colour changes at 10 doses from black to red as a reminder for them to order a new prescription. The next inhaler we're going to look at is the Handihaler, which again is a dry powder inhaler, but this time comes as a capsule. The patients open up the device and open up the mouthpiece, and this is the area where the capsule would go into. They insert the capsule, they close over the mouthpiece, they depress and release the button at the side. This then punctures holes in the capsule to allow the release of the dry powder. The device is now ready to use. And again, like the other dry powder inhaler, the patients would take a breath in, breathe out, sealing their lips round there, and take a breath in. With the Handihaler, particularly with people with chronic lung conditions, they may require to take 2 or 3 breaths in, and this is fine. And often when patients are first starting with the inhaler, they will learn to take the capsule out, pull it apart and check if there's any medication left in this. Usually after a couple of days of using the inhaler, they don't require to do this, but it is a check for themselves. To use the HandiHaler, the patient opens up the device, opens up the mouthpiece and inserts the capsule. They would then close the mouthpiece, press and release, and the medicine is now ready to take. When using the HandiHaler, the patients will hear the vibration of the capsule in the device, and this is very common. Important mistakes that patients do make with this device is that they depress the button at the side but unfortunately do not release it, therefore no medication will actually be administered. There's no dose counter on this, it is a supply of a month's supply of capsules. The next inhaler we're going to look at is the Respimat, which is prescribable with tiotropium. Initially, when patients get the inhaler, the canister is separate and has to be inserted into the device. With the yellow cap at the bottom, this is inserted in fully prior to putting the cap on. The inhaler would then look like this when the canister is inserted. The inhaler also has to be primed prior to using, and there are arrows on the device to indicate how you would turn the device. When it comes to using the inhaler, the patients would press and turn the inhaler, open up the mouth cap cover, take a breath in, breathe out, seal their lips tightly round that, start to breathe in while depressing the grey button, and this releases the medication. Again, they would withdraw the inhaler from their mouth, holding their breath for the count of 10 or as long as they feel comfortable. To take a second dose, they would recover the device and start the process again. There is also a dose counter at the side as a reminder for patients when they are needing to renew their prescription. I will now demonstrate how to use the Respimat inhaler. Press and twist, open the cover, Moving on from the Respimat, we have now a pressurised meter dose inhaler, which is an aerosol inhaler. This one here is an easy breathe inhaler, and patients would activate this by first shaking the device to mix the propellant and the medicine. They would open up the mouthpiece, the device is now ready to use. Again, they would take a breath in, breathe out, seal their lips round there, and start to breathe in. The medicine will be released by their breath activating it. They will carry on breathing in, remove the inhaler from their mouth, and hold their breath for the count of 10 or as long as they feel is comfortable. If they require to take a second dose, they would close the mouth cover and start the process again to activate the device. Important things to remind the patients when they hear the puff of the inhaler, that is, they have to carry on breathing in at that point. Many patients do stop, in which case they do not get their dose of medication. I'll now demonstrate how to use an easy breathe inhaler. The next inhaler we're going to look at is the pressurised meter dose inhaler. This can be used on its own, and patients would use this by removing the dust cap cover, again giving the medicine a shake, taking a breath in, breathing out, having a good seal with their lips round there, and as they start to breathe in, pressing down in the inhaler and carrying on, breathing in. They would want to take a nice steady breath in. If it's too deep or too fast, the medicine would tend to hit off the back of the throat or in their mouth, and the lung deposition would be reduced. I will now demonstrate how to use a meter dose inhaler. And again, if patients can hold their breath for the count of 10, that would be helpful. But again, however, some patients are unable to do this. If patients require to use a second dose, they would shake the inhaler again and start the procedure. Many of the aerosol inhalers do have a dose counter featured on them, and this varies depending on what medication is prescribed as to how many doses are in the canister. Many patients we see, however, who have meter dose inhaler, their technique is suboptimal. Therefore, we often advise patients to use spacer devices, and these are a couple of the spacer devices that are available, and these are readily available on prescription. The first one is a small spacer device, which is quite commonly used as it is fairly compact for patients to carry. Particularly for patients with chronic lung conditions, it's very hard for them to take one steady breath in, and spacer devices do give you the opportunity to teach them tidal breathing to use their inhalers. The patients again would shake their inhaler, insert it into the spacer device, remove the cover. You would ask them to seal their lips round the spacer, depressing down, and if possible taking one steady breath in. If not, you can teach them tidal breathing. I will now demonstrate how to use a meter dose inhaler with a spacer device. Removing the cover, inserting into the device, and again, if patients are able to hold their breath for the count of 10, this is beneficial. I will now demonstrate using tidal breathing to use a meter dose inhaler with a spacer device. Again, the inhaler would be shaken and inserted into the device. Patients' lips would be sealed round the mouthpiece. One dose would be depressed, but in this occasion patients would be able to breathe in through their mouth and out through their nose for about 3 or 4 breaths. I will now demonstrate how to do this. This device would also show the patients if their technique was satisfactory. If patients take too deep a breath or too fast a breath, the device will whistle. If this is the case, the patients are encouraged to steady their breathing down and not to take such a fast and deep breath. Another spacer device that is commonly used is the volumatic spacer device, which when patients initially get it, comes as 2 parts, which they would have to join together. Again, they would shake the inhaler, insert into the bottom, and this is the mouthpiece for the patient. This inhaler device does not have whistling sounds, but when patients do breathe in and out, there is a valve that moves back and forward, so patients are aware if they are able to use the device. Again, they would take one puff, breathe in, hold their breath if possible for 10 seconds. But again, like the smaller device, patients can be taught to use tidal breathing with the Volumatic. I'll now demonstrate how to use a meter-dosed inhaler with a Volumatic spacer device. Probably cut that bit. Patients would shake the inhaler, remove the dust cap cover and insert into the spacer. And again, if they need to take a second puff, gently shake the inhaler and repeat the process. As I said, the Volumatic spacer device can be used to teach tidal breathing, and I will now demonstrate how to do that. Important things overall for inhalers to remind patients is to, obviously, when they get their inhalers from the chemist, is to check the expiry date to make sure it is in date, and obviously to check inhalers in the house if they've not used these for some considerable time, that the inhalers are still in date. It's important also, whatever type inhaler they're using, to check that the mouthpiece is free from any foreign bodies and that the inhalers are kept clean. Each inhaler device does have an instruction leaflet with it, and it's important to remind the patient, albeit they have been educated, to read this instruction leaflet prior to using the device. The spacer devices also have instruction leaflets, and again, it's important to encourage the patient to read these prior to using the device. In the instruction leaflet, it also advises about cleaning the spacer devices, and the recommendations are in the guidelines to clean your spacer device on a monthly basis. It's also important that these devices are renewed, and the recommendations would probably be about every 6 to 12 months to have a new prescription, to have a new spacer device.